And we're live. Good afternoon, good morning, or good evening, depending on where you're watching the show. This is the Healthcare Thought Leadership LinkedIn Live show. My name is Marion Spears Carr, and I am so glad that you're here. If you're watching live, let us know in the comments where you're watching from. Today's conversation is one that I've been excited about for quite some time. It's a group of individuals and very, very great company that is making a difference for healthcare organizations across the United States and around the world, really. And I really am excited about it. Our topic for today is bridging the gap between digital health solutions in the U.S. market, and the company that is doing that, this boutique consulting firm, is CalleoHealth. And here with us is their whole team, or at least part of their team. I'm going to introduce their president and CEO, and let him introduce his team, and then we're going to get into a conversation around the challenges companies, healthcare, facing in terms of making decisions on what digital technology or AI technology or whatever technology they need from a revenue cycle perspective or any other area within healthcare, how to get through that process and how they help organizations make the right decisions. Avi Rosenvig, I know I mispronounced your last name as always, but Avi, glad to have you. Say hello and introduce yourself, a little bit of the company and your team, and then we'll jump into the conversation.
Thanks for having us, Marianne. First of all, Avi's good. Last name doesn't really matter. I'm a one-name person.
That's awesome. I knew I
Appreciate the
was going to
time.
butcher it.
Yeah, absolutely. Always get to hang out with you guys. As Marianne mentioned, CalleoHealth founded about 4 years ago with just a phenomenal team. It's a lot of fun to work with my team, become good friends over the past couple of years. Work hard, play hard is really what we do. And our goal always is to make a huge difference in the state of healthcare in the U.S. We feel like we're doing that slowly, and we're going to keep doing that. So quickly, Dolev was one of the founders that started with me day one. Dolev Mohammed lives right now just outside of Boston. Sarah joined us about a year ago. She's in charge of our customer success. And Mark Miles is a more recent addition. He's VP of Operations and Sales. You know, if you don't sell, you can't make an impact. So that's briefly who we are.
Well, that's great that you shared that. And you and I got into a conversation. You and I and Noah, we and Sarah, we all met last year at ACHE Congress. We're going to talk about that a little bit later in the conversation, because you guys host an amazing event that we want to let the listeners and the viewers hear about, particularly if they're going to Congress for American College of Healthcare Executives. But one of the things that we talked about was this: healthcare companies have a lot of choices now. Investment in the digital health space, particularly, has gone up dramatically. One of the areas that I work, and for those of you who don't know me, I run a company that I founded called Inflow Executives. We're healthcare executive search and leadership development and leadership solutions company. And one of the areas that I really focus in is digital health as it relates to social determinants of health, at-risk patient populations, et cetera, because I work with hospital systems across the country. But one of the things that you and I got into this conversation about, Avi, is that there's so many options, there's so many choices, there's so many different solutions, but people in these organizations are in the trenches dealing with patients, dealing with financial structure that they are trying to reestablish. We've got, and you guys formed during the pandemic and got to see that whole impact on the organization. But your company helps these organizations make the right decisions. Talk about that part of your work. How is it that CalleoHealth and your team help these organizations find the right solutions, where those solutions come from, and the problems that you're solving?
You know, Marion, it's a great point. I think the thing that we really started on and we kind of based the company was utilizing the network that we have of senior healthcare executives throughout North America to understand what their challenges are, what their needs are. We can think whatever we want to think, but we're outsiders to some extent. So when we speak to our advisory board, when we speak to those the executives in the different healthcare systems on an ongoing basis, payers, providers, acute, post-acute, we understand their real challenges, we understand their real needs. They often turn to us asking, do you have a technology that can solve this? When we bring on new clients, new technologies, we always go back to our advisory board. Who have you seen in this space? How does this company compare? Before we sign any contract, we ensure that we're finding not only a solution which is cutting edge, but which is also solving a real problem within healthcare. And as we kind of work with them at the beginning to understand what their business model should be, we go back to our advisory board, we interview executives, and we kind of play along with them objectively. We don't come in saying we want to sell you something. We come in with asking objective questions about new technologies, about challenges that they're facing, and how would this impact. So everything that we do is focused always on two goals. How do we create better clinical outcomes, and how do we create better financial outcomes? If we can solve any issue, any substantial issue, with a solution that improves both clinical and financial outcomes, and our advisory board says this is really good, this is important, we're interested, that's where we know we have a winner. We're always doing our due diligence. We're always looking out for what's next, for what's best. But it really starts with our significant network.
When you first meet with a potential client and they probably roll out a list of problems that they're trying to solve, how do you help them prioritize where they need to focus first? Because I think back to the earlier comment, earlier point that you were making is they have so many solutions, which we talked about, and you have so many different things. How do you help these organizations like dial in on where they should start first? And by the way, we've got a couple people checking in. Dr. Volpe checking in. Thanks for watching us live. If you're watching live, please let us know in the comments. We'd love to know who's watching the show and who's with us live. And I see Dr. Owens is checking in from Alpharetta, Georgia, not too far from where I live in the mountains of Georgia, up in Jasper. But Avi, talk a little bit about that. How do you, what's your first, like, what do you do when you get started? When you're like, because they've got all these different problems. You mentioned trying to improve the clinical operations or trying to improve the revenue. How do you get started? Like, where's the starting point?
You know, it's funny. We're very fortunate. Our chairman, our partner, is a guy named Dr. Jonathan Ringo. Jonathan was the president of Sinai Hospital in Baltimore. He comes from a value-based care space. So often our first inkling is, what are you doing towards value-based care? Do you have an ACO? Do you have Medicare Advantage programs? But ultimately, we really let their executives, the healthcare executives, lead us, guide us to where they see their challenges, to what focus they have in this particular year. And obviously, each healthcare system is different. Typically, what we find out is you had a big failure last year. That's where you're going to focus on looking for improvement this year. As we bring on new external technologies, we go back to those healthcare systems and say, hey, we're thinking of bringing on this company. Is this a challenge that you're facing as well? I think one of the keys that we learned from our ongoing conversations is we need to have flexibility. So, for example, something we learned early on, sometimes a healthcare system may have an operating budget surplus. Sometimes they may not. They may have a capital budget surplus. How do you go in and try to help them work through their specific challenges that they need to resolve now within a budget that they can actually live with today and going forward? So it's literally just listening. I was brought up with, you have 2 ears and 1 mouth for a reason. Listen twice as much as you talk. And that's, I think, the way we approach things. I think one of the keys also is we're not a pushy team. We're not here to sell you something. We're here to bring you real solutions, understand what solutions you're looking for, and then be able to offer you solutions to problems that you're bringing to us.
When you came into the market, when this company was formed and you started looking at the variety of competitors out there and who your competitors were, you and I talked about this. You just mentioned one of your differentiations, and that is you're not there to sell them. You're there to advise them, help them find the right technology, find the right solution, etc. What surprised you, though? And this is a question we didn't talk about. So, Avi, I told you I was going to ask you questions that are off the
We love
off the
curveballs.
chart. Yeah. Sorry about that. But I think this is important for me in this discussion, not for me, but for our listeners, is what was surprising about the market when you first jumped into it. That was like, there's a gap here that's not being met. What surprised you about it?
So we actually came from the flip side. We originally founded CalleoHealth as a consultancy for startups to help them understand, how do you go into that market. So we were doing a lot of primary market research. We were interviewing C-levels and hospitals and payers and providers and asking them about a technology that we thought could be interesting. We found out very quickly that it's very challenging for startups to be able to penetrate these markets, even with the right information, even with the right network. But I think what really shocked us when we moved more towards being a consultancy for the healthcare system. By the way, we don't we don't charge healthcare systems. We see the healthcare providers as our partners, partners in crime, so to speak. But I think what surprised us most, at least me, was how many different vendors these systems have that even the executives don't understand what each of the vendors is providing, can provide, how many conflicting contracts they have. So when you go in to speak to somebody, oh, I think we have something like that, they need to start digging through old contracts and figuring out and cleaning up, so to speak, who their providers are, who their source of different technologies are, and they bluntly have very little knowledge and opportunity to spend the time vetting what they already have and vetting what's out there in the market. I think that's really where we have a significant advantage, and that we do. That's a large part of what we do. How do we vet the technologies? How do we make sure that what we're bringing to market matters and is good? And Marion, you know this as well as I do. At the end of the day, the technology could be the greatest or the second greatest or the third greatest. That's not even the key. The key is how does it work within the workflow of the physician? How does it work within the flow of the IT team? All the integration challenges, all the issues that we need to overcome to work within a healthcare system are more important than the best technology. Great technology is important, but the other parts of it are even more important.
It's understanding the users, understanding how they're being trained, understand what they know about the platform or the different processes, what impacts. All those things are important. I work with both medium and small and very large health systems across the country, and it surprises me sometimes. Maybe it doesn't surprise me after 33 years, but it surprises me sometimes how siloed these organizations still are. IT's doing their thing, nursing leadership, nursing, not being critical, but it's just they're so focused on all these different components of what they have to do. It sounds like one of the things you guys do is actually kind of look at the whole thing from a holistic perspective and not just focus on, as you said, the technology solution, but how that integrates with what they already have and how that supports the individuals, the users. Would you agree with that? And maybe talk a little bit more about that. I think that's important.
100%. Actually, let Mark take over that part of the conversation. Mark has really led large parts of our complementary technology pieces. Please go, Mark.
Yeah, I think that's a great point, because one of the things that we have found that is a challenge for a lot of the organizations is when we start talking to them again, have they looked at other solutions, or are they even aware that some of these solutions are out there? So a lot of times we'll have folks that we're talking to that will say, well, how are other people in the market that would be similar to me using this type of technology? How is it benefiting their patients? How is it benefiting their organization? So we're able to bring those best case practices, if you will, to those organizations. And then within those organizations, one of the great things about being able to provide multiple solutions is that a solution for one area within the organization may be very different than how we would use it in another area. We can still work with both of those different groups or multiple groups within a healthcare system, but they have different needs. So the orthopedic side may have a very different need from the case management side. And that's exciting for us as well, as to be able to bring those different solutions to the market.
So a follow-up question to that then, Mark, is when you are talking to these clients, how do you advise them who their internal stakeholders are? Because a lot of times, say for example, orthopedics, you mentioned that they have a problem to be solved, and they're very focused on solving that particular problem. But there's all these other stakeholders that might be involved. How do you go about saying to your client or to the healthcare system, hey, maybe we need to get XYZ from the other departments in? How do you go about that process? I'd love for you maybe talk a little bit more about that, because I think if you think about our audience, we're coming from a lot of different areas.
I think that's a great point. And I think, staying with that same example, the orthopedic group may be looking at one particular thing if they're doing hip replacements or whatever that happens to be. But from a health system standpoint, how is that affecting 30-day readmissions or anything along those lines that may affect that global situation for that one particular department? So I think our ability to to speak to one area and then using, if you will, a referral from that group into another area, because we can say this is something that can affect these other areas within the organization. Who would be the best person for us to go speak to over there? So I think that's one of the things that we're able to do, is because we bring all of those different solutions. And as Avi said, a lot of times systems don't realize that they have a lot of different vendors bringing one solution or another, where we can be the one vendor that is bringing multiple solutions. It certainly isn't everything that a health system needs, but we can bring a lot of solutions that cross many areas within that organization.
Right. Great answer, Mark. Avi, tell me a little bit about, from a financial perspective, like who are the key people that you talk to in the organization, and maybe give us an example of some of the financial improvements that you guys have already made. Obviously don't give away your clients, but I'd love for maybe to talk about, like, who's your point of entry? Is it the CFO? Is it the CEO? Is it the chief information officer? And then maybe talk a little bit about kind of the work you're doing around the revenue cycle side of it as well.
Sure. So it really depends on the size of the hospital. Often we start with the chief medical officer. They're the ones typically have the purview on both the financial operational ends. Often it starts with the CFO. As you mentioned, rev cycle is a huge opportunity in so many places. How can we reduce costs? How can we create new efficiencies? How can we create opportunities where you're not only providing better health, but you're also actually saving your staff burnout and lowering your costs, for example, of traveling nurses, of contract nurses. So it really depends on where that conversation starts. Often CFO, COO, CMO are the starting points, but they almost always have to bring in so many people throughout that team to go through and be champions of different parts of that conversation. Pop Health certainly takes a huge role in what we do. So often even a director of Pop Health will be a champion and then kind of bring us along the way to wherever we need to go. I'll give you one quick example. Something we're working on right now as we speak, has not happened yet. We have a healthcare system which has a significant issue with maternal health, we'll call it. As we know, African American women suffer from significantly higher maternal death rates and lower and more fetal issues, etc. So one of the areas that we're looking at right now for a particular system is the opportunity to use an external team to do a quick evaluation via telemedicine. One phone number, be able to give them an evaluation. Yes, you need to go to the hospital. No, you do not. And if you do, to streamline that conversation, have the patient go straight in to the ER with all the paperwork already done. It literally just saves a huge amounts of administrative load for the hospital system, and it saves time for that patient who now just shows up. One of the areas that we've done quite a bit of work on is virtual nursing, whether it's discharge or patient intake. Nurses don't want to be doing paperwork. They don't want to sit there filling out forms, and bluntly, they're overworked, they're understaffed. The ability to have U.S. licensed providers not sitting in your hospital with a screen, be able to take that administrative load off of your healthcare system, not only provides a much better work environment for your nursing staff, it's financially not only viable, financially positive. It saves money, it saves time, provides better services. And that typically that conversation starts with a CFO, because that's a financial component. Chief nursing officer has to get involved there. The COO often has to get involved in that conversation. So we really do look at many different champions throughout the system that kind of pull together to make these decisions, which is why often the timelines for making these decisions can be somewhat extended.
I would also add that it kind of flows through into the conversations that we have with startups, that, we're, especially some of the earlier conversations, when they're kind of figuring out and they think, okay, we have this great product and this is how we're going to enter the market. And a lot of times they don't fully understand the economics of the U.S. healthcare system and how things are paid for and what kind of, business model makes sense for it to be successful and for it to be adopted. And so a lot of those, that information and insight that we have from the U.S. healthcare system, we're bringing that over to the startups to explain to them, the importance of having a flexible business model, multiple options, different types of pricing, understanding the value proposition in a fee-for-service model versus a value-based care model. Hopefully you have both, because, not all hospitals are in both spaces. And so I think that's, kind kind of making sure that that information makes it to the startups, kind of going back to your point about, or your question about what surprises us. For me, especially with it being such a crowded space, there's so much technology out there. But it's almost surprising how many startups there are and how many new technologies there are coming out when you think of how many things really need to align for a startup to take off, starting with the initial funding, getting through the product development, and really being able to penetrate the market enough and be able to stay afloat long enough with your funding until you get revenues from commercials. It's kind of amazing that we have as many technologies as we do. And I always, it kind of breaks my heart to see the technologies that fail, because a lot of them really, they would be, so much better for patient care, so much better for providers, for everybody. And so when you think about, the failures, it's, that's what we're here to do, is hopefully get them to market faster so that there's fewer failures, help them stay afloat until they can take off.
That's a great point, though, of it, and about the startups and about helping them. You also are providing a service to help them get connected in the marketplace. And I love what you said about understanding what their value proposition. Matter of fact, I believe this is the conversation that you and Avi and I had when we met last year at ACHE. Because I introduced myself and you asked me what I did or something, and I said, yeah, part of the area I work in the executive search space is with private equity and investment in healthcare startups. So that's one of the areas that I work. And I think that's how this conversation started. There's one of the things, and maybe this is a question for you, Dula or Avi. How do you guys keep up? Like, there are so many technologies. Like, how is it that maybe that's the secret sauce we shouldn't tell everybody, but how do you keep up with all of these different platforms that are coming out, all these different solutions? And now with AI, I just did a LinkedIn Live show with an AI ethicist. We were talking about the ethics of AI. How do you keep up with all of it?
So, Love, you want to start it?
I'm not going to say that we know about every single startup out there. That'd be a lie. But we do our best. A lot of reading. We do our best to get out to conferences and kind of learn about what's out there. A lot of times you're reading an article about a success story at a specific hospital, and then there's a mention of a certain technology. We're kind of doing due diligence. So when a technology comes across our desk, it's, who else is in this space? What else is out there? Is anybody doing this better? And, a lot of it is the people too. So you have a great technology. We've unfortunately come across, there's sometimes where the technology is great and everything is great, but if the personalities aren't compatible, we kind of always say it's not someone you want to have a beer with. The contract isn't going to get signed. And that's also sort of this unfortunate reality of, you got to make sure you have the right leaders in the company, especially external facing folks in the startup. So some of it is just vetting the people. Avi, I'm sure you have more to add. You've been in this space a lot longer.
The only thing I'll add to that is, we started out really as an Israel-focused technology company. Israel is a very small country. Everybody tends to know each other. I mentor several startups from different programs. Technion from actually the Stanford program in Israel, as well through Rambam Hospital. I've become a mentor the last couple of years for the Eastern European Roche Digital Health program. So people do tend to know me within the industry, know us as a company, as a team.
Yep.
So we do get introductions to a lot of companies. Often we see a deck and we look at it like a deck is horrible, but maybe the team is better than the deck. You kind of have to filter through and sift through some garbage before you figure out what's good, what's not. Excuse me. The Israeli system is certainly small enough that it's relatively easy to know. The global system is much, much larger, but there tend to be hubs, especially in digital health and health IT, where most of the successful startups come from those hubs. Not all of them, and certainly we can't reach everybody.
Yeah, a matter of fact, that you mentioned, how everybody in healthcare in Israel seems to know everyone. That is true. I have one client there, and on the med device side, And every time I bring it up, somebody actually knows the man that runs the company. Like they literally know him. It's not like, oh, we know of that company. No, we know the man that runs it. So that they all know each other. And I think that having that connection and knowing everyone and being able to leverage that, people know who you are and you get connected. We're almost out of time. So I want to talk about, and by the way, if anybody has any questions for this group, I posted in the chat or in the bar that, if you have a question, please post it up. We can run a few minutes, but you guys have a big event coming up at ACHE Congress. And for those of you who are familiar with the American College of Healthcare Executives, every year except during the pandemic, the gathering is, called Congress of ACHE Congress, and everybody comes in for it. People that are renewing or trying to get their fellow American College of Healthcare Executives. It's a great way to get a lot of hours toward that. I just renewed my fellow last year, so probably won't be going for as many of the meetings, but I will be there for at least 2 days of the conference. But you guys have an event called Whiskey Business that's a massive networking event. I'd love for you to talk a little bit about that. Maybe, Sarah, you could tell us a little bit about it, and then and how people can connect with you guys to show up and network at this particular networking event you guys are sponsoring.
Of course. So it will be our third annual Whiskey Business event. Unfortunately, I cannot take claim to the name and branding, but it will be my second time around. So I'm really excited for this year. And I think the most exciting thing for us about Whiskey Business is really just meeting people, meeting new people in the space, leaderships, and hopefully just kind of building a strong network and relationship that we can expand on, introducing them to other leaders within health spaces once we hear about their challenges. That's another thing I think we're really good at, is making connections and introductions within the industry itself. And so we're really excited about this year. It's a great opportunity for healthcare executives to come taste some of the finest, most premium whiskey out there. If you're not a whiskey drinker, there's a few other options, so don't worry. But in the end, it's great conversation. I think that's like one of the biggest components is, people are enjoying the whiskey, but also really enjoying the conversations, getting to know each other on a personal level, getting to hear again about what's going on in the healthcare space. And so it's a great opportunity. And I think the best way to kind of reach out, one, you can go directly to our website, CalleoHealth.com. There's a Whiskey Business tab. You can register. If you want to learn more, you can also reach out to events@CalleoHealth.com, and we're happy to answer any questions you have. And if you'll be at ACHE, you'll probably see us there in the lobby on Monday or Tuesday. Hopefully you'll recognize our faces, and we're happy to kind of share more about the event with you. And we look forward to having you guys there.
Yeah, and by the way, for those of you who are watching live or watching the replay, and please, if you watch the replay, let us know you're there and ask questions, because we're going to be following up. But I just posted in the comments the link for them to register if they're going to be at Congress. Message me as well. Last question, Avi, I'm going to throw it back to you. Oh, maybe Sarah, tell us the time and location, yes, so they know what day and time during Congress.
So it is on Tuesday, March 26th from 5 to 10 p.m. It's kind of a come in and come out as you go, because we know a lot of you that are attending ACHE are catching up with your colleagues or doing other events and dinners. So feel free to stop in at any point. And it is located in the Radisson Blu.
Well, awesome. That's great. So, Avi, last question, or I'd love for you to wrap us up. Tell me a little bit about, like, when it comes right down to it, you've talked about your differentiators. You've talked about the fact that you know about startups, and they'll have really shared, and Mark shared how you've kind of vet the process. What's that one thing about CalleoHealth that says you need to work with us? I know I'm putting you on the spot, but this is your chance.
Actually, I'll tell you the truth. It's very easy. It's who we are. It's the team. We are just really healthcare we love healthcare. We love this space. We're passionate about it. We believe in what we're doing. We're low pressure. We're always smiling. When we get together, which doesn't happen frequently enough, we have a great time together. We try and tend to have a great time with our clients as well. You're not going to feel us breathing down your neck saying, hey, you got to sign something. You're going to feel just friends and hanging out. It's where everybody knows your name. Call us up, schmooze, talk. We want to talk healthcare. We want to learn from new healthcare. We want to do everything we can to know more about what's going on. And if that turns into business, wonderful. And if it turns into a friendship, wonderful. It's really just a team environment. We go out every Monday, the night before Whiskey Business, and hang out as a team. And I mean, it's nonstop laughter. We just have a blast together. And it comes out really in all of our meetings, in working in hospital systems. You see it very quickly. It's genuine. It's who we are.
Yeah, and I gravitated toward you guys last year for that very reason. You guys were talking to everyone. You were smiling like you were having a good time. I wanted to be a part of the crew that was having such fun. So that's why I probably strolled over to your table to begin with. So thank you for being with us. The days, this is a special day for my typical show. This is the Healthcare Thought Leadership LinkedIn Live Show, my weekly show here on LinkedIn. If you're not connected with me, please connect. And if you're not connected with anybody on the screen, send them a connect request. Click on that link if you're going to Congress and sign up. Let them know. Let us know that you're going to potentially be at the Whiskey Business on Tuesday. And for Mark, Dolo, Sarah, Avi, thanks for coming on the show. And I'm really glad to have you. Have a great day. Have a great rest of your Monday. And we'll see you next week in Chicago.
Thank you.
Mary. We'll see you next week.
Thanks, everyone.
Bye-bye.
Bye.